particularly recognize two of our board members. We have Jonathan Lawrence, who is the CEO of the Lake Erie Regional Health System of New York, mouthful, but LERSNY is how we know and love it, and Howard Howlett, who is, I believe, our longest sitting board person on the CCHN board. Does not? Now, did I do that politically correctly?
I'm not that old.
You're not that old, that's right, but you have tenure on the board.
That's what started.
I want to welcome everybody here today, and I'm going to turn it over to the Congressman to start it off, and then I can tell you some more specifics about how we actually plan to use the funding.
Thank you very much, Ann. Jonathan, Howard, everybody else who's here. Today, I'm joined by healthcare leaders and members of Chautauqua County Health Network to announce a $300,000 grant from the United States Department of Health and Human Services, Office of Rural Health Policy. Chautauqua County Health Network will use these funds for a new 3-year initiative aimed at reducing health complications for 6,000 diabetics and 7,000 heart disease patients right here in Chautauqua County. 14 primary care practice teams led by 35 local physicians will implement the chronic disease self-management programs for patients. Use learning collaboratives to advance care and employ a common electronic patient registry toward the goal of improving health outcomes amongst this population. In addition to the clear health benefits for patients, shared technology and more efficient service delivery are expected to reduce costs for local health care providers. This grant will complement Chautauqua County Health Network's ongoing involvement with HealthyLink to improve the quality of care through the implementation of health information technology or electronic medical records. HealthyLink was recently awarded $16.1 million of a Beacon grant, the largest in the entire nation, to fully integrate health information technology into care and treatment for patients with diabetes. Just yesterday, Dr. David Blumenthal was here in Buffalo. He is the National Director for Health IT in the United States Department of Health and Human Services. He was in town to laud the efforts of Western New York healthcare leaders to become early adapters of healthcare initiative. And I just wanted, on that point, I made reference to this before, but the medicinal scholar, practicing surgeon and writer for the New Yorker, Dr. Atul Gawande, had stated in an article he wrote a couple of months ago that the solution to healthcare delivery will not come from Washington. It will come from an early adapter, an outlier, those who embrace the tools of healthcare reform and demonstrate to the rest of the nation that it can be done. And I will tell you that Western New York, including Chautauqua County Health Network, is well positioned to be that outlier for the rest of the nation. And there are tremendous benefits, and it's announcements like the Beacon Grant, the largest in the entire nation, recognizes that the healthcare leadership of Chautauqua County and Erie County had the presence of mind to understand where this thing was going. They say the great hockey players aren't the ones who know where the puck is, they know where it's going to be, so that they can position themselves for maximum success. And I think that's true with the Western New York healthcare leadership. And Ann, through your leadership here, you are a part of that effort. And this is just the beginning of, I think, many more announcements of this nature to come. So thank you for your leadership.
Thank you so much. Thank you so much. We are up to our eyeballs in electronic communication, health recording, aggregating, analyzing, and it's going to be an interesting ride. But we are very, very excited to be part of it. And this grant is exciting for us because it gives us a little bit of a bridge. There's all these exciting things happening around. The REC grant, Beacon, the HEAL 10 efforts around the patient-centered medical home. But this is going to be an interesting grant to sort of really get in and do some fine work with quality improvement in 14 primary care practices in the county. We're going to be developing patient registries with point-of-care decision support software solutions. The chronic care registries are viewed as the sort of an effective stepping stone for some physicians who, all of our people in Western New York, for the most part, are learning how to use electronic records. effectively. You've heard a lot of terminology out there called meaningful use. We have a lot of work to do and training to do over the next 18 months to get people to meaningful use. Some folks are, that's really going to be working with the people who are really interested in starting to use a record. These registries will be sort of a primer for those folks who don't necessarily want to go all in on a record in the beginning, but it allows them the opportunity to start to build a registry, get a little familiar with the technology, and see the benefits of it. So, well, as I said, we have plans to work with 14 practices, and these are practices that signed on with us last spring when we made this application. And we're going to be working with a small team of consultants to accomplish the activities of the grant. We're going to be working with an IT specialist from the Camden group who is going to help us with a vendor selection to build a uniform registry platform that can aggregate information from separate physician offices into one database. And we're going to be targeting diabetes and cardiovascular disease and pulling in these performance metrics, then being able to look at them, analyze them, present information to the practices to look at opportunities where they could see some improvement, where they might change something within their practice that they're doing that could produce a better result for the patient. And we're going to be using all of what they call best practices in medicine. And so we're going to be using a tool called a PDSA, which is a Plan, Do, Study, Act cycle, which, you know, we will present data to an office. Let's say it's looking at blood work, terminology like blood lipids and blood sugar levels. Something doesn't look quite right with a certain group of patients. They can look at that information as a team within the office, say, well, what if we tried this? The Plan, Do, Study, Act cycle allows them to do a quick change, test it very quickly. If it looks like it works, then they can broaden it out in a much broader application. Hopefully that makes a difference to move that needle, to see an improvement for patient care. We are going to also be using our practice enhancement associates, and that's Maureen and Mary Carla, the services of McLean Associates, who will be working right in the offices with the practices. You know, we'll develop these registries. They'll go in, help them install it, learn to use it. They'll be doing training on the chronic care model, training them on the PDSA cycles, sort of cracking the whip, if you will. That's what they're going to become very proficient at, I think, before this is all said and done. I would frankly echo what you said before. I think CCHN is very well positioned to be successful at this. We are just coming off of a pilot program with Healthy Link and also the P2 Collaborative of Western New York, who is really focused on quality improvement in the healthcare system. And we just came off of a pilot program with them with creating diabetic registries in 5 primary care practices, individual practices, and have seen some fairly significant changes. I think in 11 or 15 metrics that we measured, we saw improvement in at least 11 of them, just in a short period of time, over 1 year. And it was not as focused and intense an approach as what we plan to do with this grant. So we're going to be taking on, you know, developing the registry in the first 6 to 9 months, get the diabetes registry up and running, start working on improvements there, then bring in the cardiovascular disease registry, start to work on that, and the hope is then we can branch that out to other primary care practices in the county. So we are thrilled to pieces to be here with you today.
Thank you.
And have this opportunity, and stay tuned because it's going to be an interesting ride with all this electronic medical record implementation.
Okay, thank you very much. Any questions to the media, Jade?
How soon will this be implemented then?
Interestingly enough, the clock started ticking August 1, so we will be doing this through July 31st, 2013, right? Okay. Yeah, but it's immediate. So we had anticipated that perhaps we had hoped that we might get funded, and we had some other plans in the works, so we really are going to hit the ground running with this.
Very good. Thank you.
Thank you very much.
Thank you.
Yeah.